our listeners today, me included, know what you're going through. It cannot be easy dealing with people who've been waiting for 12 hours. Love to hear from your point of view what you think is going wrong, what might be done to help the situation. Right now, let's hear from Stephen Dorrell. Stephen is the former Health Secretary and now Chair of NHS Confederation. Season's greetings to you, Mr. Dorrell. Thanks very much indeed for being with us. It's shocking, this report, isn't it?
It is indeed. Thank you for your season's greetings. But as you rightly say, there are many people working in the health service over Christmas, over the New Year, who know full well that waits in A&E have been rising. And no one, I mean, it's a statement of the blindingly obvious, isn't it, that no one should be required to wait in an A&E department for anywhere near 12 hours.
And the simple...
You go to an A&E department because you have an emergency, or that's how it should be, which needs attention quickly.
And the simple answer, Mr. Dorrell, surely, is money. I mean, your government tells us that, you know, they plan to increase the budget by £8 billion a year, but it's argued very efficiently and persuasively, but in my view, by the King's Fund, that, all right, it's okay saying you're going to give all this money to the health service, but as a proportion of GDP, that spending on the health service will actually fall because the economy will grow faster than the NHS budget. So the situation is going to get worse rather than better, isn't it?
Well, there are two answers to that. The first is that I've myself made that argument on behalf of the NHS Confederation as well. I agree with the King's Fund that it's not realistic to imagine that the NHS share of national income will fall over the coming years. But what's also been said, and rightly so in my view, by the King's Fund, by Simon Stevens, the Chief Executive of NHS England, and again by myself, is that it isn't just about NHS spending. It's actually more urgently at this moment about spending on social care and the range of public services around the health service.
Because they're the people who are blocking the beds.
Well, yeah, that's to look at it from a hospital's point of view. Why don't we look at it from the individual citizen's point of view? Nobody wants to be in hospital, whether in an A&E department or in a hospital bed, if they don't need to be there. And what we ought to have, what we need urgently, in my view, is better developed public services that prevent people unnecessarily going to hospital. Then the hospitals will be better able to deal with the people who do need to be there.
Well, it's within the gift of this government to do that. And one of my contributors, Roy Lilly, who I'm sure you know, was saying earlier, why doesn't any government have the courage and the guts just to simply say, right, we're going to put 2p in the pound on income tax? In my view, very few people would object if they could be assured that that money will be spent on the NHS and the sort of social services which are so essential to the well-running of the NHS that you're talking about. Why won't they do that?
Well, the governments have increased spending on the health service, and the Blair government did that on quite a big scale. What we also need to do is to spend it in the right place. And that's why I put the emphasis on caring for people outside hospital, developing GP services. Governments of all political complexions have said that we should spend more money on community services, GP services, social care, and so forth. And if you look at what's actually happened under governments of all complexions over a very long period, the money has been spent disproportionately in the hospitals.
Yeah, but under this government, proportionately, less has been spent on the NHS. The figures I had were 6.3% at one stage, went up to 9% of GDP under Blair, and back now to 6.3% under this government. So it is being cut back in real terms, isn't it?
There's actually the most authoritative view of spending on health and social care came out from the Office of National Statistics in the summer, which applied the OECD numbers, OECD definitions to our numbers. And actually the figure is just a fraction under 10% of the UK economy is spent on health and care services. What we need, where you're right, is to say that over the period to 2020, the assumption underlying the government spending plans is that will fall, and I don't think that's realistic. And it certainly doesn't reflect either our experience or the experience of other developed countries. Stephen
Dorrell, thank you very much indeed for joining us. Stephen Dorrell, former Health Secretary, now Chair of the NHS Confederation. We can easily blind all of you with figures, and I'm grateful for Mr. Dorrell for his clarification on one or two matters there. But at the end of the day, we've got a health service that's not working, particularly at A&E level. I'd love to know what you think about that and what should be done about it. What indeed is your experience of the NHS and waiting in areas of A&E where you maybe have to wait 10, 12 hours or even longer? Maureen joining me from Leeds. Hi, Maureen.
Yes, hi.